Hello everyone, my name is Muhammad Yahya Mansour. I am an assistant lecturer at the University of Baghdad College of Dentistry. I am uploading short video lectures in clinical oral surgery, which can be useful for both dental students as well as graduated dentists. So if you are interested in this subject, please subscribe to the channel and turn the notification icon on so that you know when I upload a new video. In this video, I will be explaining a simple 5-point checklist for the dental management of the medically compromised patients who require dental extraction or simple oral surgical procedure under local anesthetic. Medically compromised patients in this video refer to any patient suffering from a chronic medical problem, whether they were taking certain medication to control that problem or not. This is a very complicated subject in clinical dentistry, and I have seen dental students on many occasions who can take perfect medical history from the dental patient, and then they get stuck in the manner of speaking when the patient proves to be a medically compromised one from the history. So they don't know what exactly to do with the information they obtain, mostly because they are tired or in a hurry, or simply because they have little experience dealing with such patients, because most of their dental patients are healthy ones. So let's get started. When a patient with a medical condition attends your dental clinic, and after taking history and doing clinical examination, you have concluded that the patient requires dental extraction or simple oral surgical procedure and that the patient is not in full medical health. Sometimes you get worried about forgetting to cover some questions in the history, or to do some clinical tests, or to order some extra investigations that are related to the medical condition you have discovered. And more importantly, even after covering all that, you may be still confused as to what to do with the information you obtained. So what should be done differently for this patient as compared to the healthy one? So here is a simple checklist that you can apply to any medically compromised dental patient who requires an oral surgical procedure. It consists of 5 points only, so it should be easy to remember, and it is based on personal clinical experience, so you most probably will not find it in any published work up until this video. So, emphasizing that this checklist applies mainly for procedures done solely under local anesthetic, the 5 points are: stress, and that is stress related to the dental anxiety, as well as stress related to the procedure itself, so that it is emotional and physical stress. The second point is the local anesthetic type. So with some medical conditions, we need to change the type of the local anesthetic that we should use during the procedure. And you may also consider the need for adjusting the dose of the local anesthetic according to the medical condition in question. Now, changing the usual technique of administration of the local anesthetic will be covered in the next point of the checklist, so no need to be worried about that at this point. The third point is bleeding. So is bleeding to be expected during or after the procedure as a result of the medical condition or the medication taken to treat it? Of course, with some conditions, bleeding may cause problems even during the simple local anesthetic administration. So a modification of the technique or even changing the treatment setting to a hospital need to be considered at this point. The fourth point is healing. So is the wound expected to heal normally in this patient or not? And of course, you need to consider soft tissue as well as bone healing at this point. The last point is antibiotics as a postoperative prescription. So does the patient, after completing the procedure, requires the prophylactic postoperative antibiotics or not? Now, to put this checklist in practice, let us see some examples for its application in different medical cases. For the effects of stress, you need to prevent and be prepared to manage the following complications in patients who are expected to have them: angina or myocardial infarction, stroke, hypoglycemia, thyrotoxic crisis, adrenal crisis, seizure, fainting. And you also need to keep an eye for the effects of stress on pregnant women and the effect of doing the procedure itself on any existing joint problem, or in relation to causing a more serious systemic problem such as infective endocarditis. Now, for the second point, For local anesthetic type, the two things that you need to consider are whether to use anesthesia with or without adrenaline. For example, patients with hypertension, heart problems, or hyperthyroidism, and whether to change the anesthetic agent type between ester and amide, as for patients with kidney or liver problems. And of course, not to forget about the pregnancy in the third trimester and the caution of not using pheliprasine as a vasoconstrictor. For bleeding, complications are to be expected in the following conditions: hereditary bleeding disorders, patients taking warfarin or dicumarol or other anticoagulant medication. Now, for most minor oral surgeries, taking aspirin alone to prevent pathological thrombosis is not expected to cause a problematic post-surgical bleeding. However, if the patient was also on other antiplatelet medications such as Plavix, then the prolonged bleeding after the procedure is to be expected. Patients with anemias, of course, are expected to have other complications due to bleeding during and after the surgical procedure. So, at this point, you need to consider the need for additional blood tests or medical consultation before starting the procedure. And in some cases, the correct management is to do the surgical procedure in a hospital setting. With healing, examples of medical conditions that could delay wound healing are diabetes mellitus, previous irradiation close to the area of the procedure, and patients on medications such as bisphosphonate, or those who are smokers. As for the last point of antibiotic requirement after completing the surgical procedure, patients with diabetes mellitus or HIV infection or those taking steroids chronically are expected to have low immune responses and therefore more susceptible to infections. So they need to have a prophylactic course of antibiotic after oral surgical procedures. The other situation which merits such a prophylactic course is when the patient, even if healthy, presents with an established local infection such as cellulitis, or if only a partial drainage of abscess was obtained after completing the procedure. So there you go. Only 5 points to remember, covering for all medically compromised patients. Don't get stuck and don't get confused when facing those cases ever again. Now, unfortunately for you, you still need to study your lectures and textbooks. But at least now you know how to study and what to focus on, and you have a reminder that is always with you. Thanks for watching, and I will see you in the next video.